Welcome to the CNS Podcast featuring Dr. Daryl Anaba, Research Director for CNS Productions.
Terms like chemically assisted detox or chemically assisted recovery, replacement therapy, recovery-pharmacotherapy, those are scary terms, and they're almost oxymoronic. They would have definitely been oxymoronic just 5 years ago. But what's happening in the field is a growth in the understanding on the neurobiology of addiction that's occurring so rapidly and in so much detail that there's more medications in development to treat addiction than there is to treat almost every other medical condition there is. And that's a real challenge, and that's a scary thing, I think, to the recovery field, especially because we know that part of this problem is a society that has been raised and continues to be inundated with media messages, radios, friends. I saw a play called Distractions, where a whole community was pumping drugs at you, that you can take this medication to treat this condition. You can take this medication to make you feel the right way that everybody else should feel. The real agony that families go through if they have a child diagnosed with attention deficit hyperactivity disorder, and not just their doctor, but their neighbors, their teachers, their even their spiritual contacts are saying, get that kid on some medication. So we're a society that's relies that there is a pill to fix anything. And if you go to see a doctor, say you got an ache in the side or you've got a sniffle, and you go to see a physician, you make that trip and say, well, this is serious, and I'm going to go see a physician. And if that physician tells you, look, you're just having a virus, it's just a stress relation thing to a workout or stress at work, and just take a cup of aspirin or just relax and stay in bed or don't work so hard and let you go out of the office, most Americans are going to feel totally ripped off. They're going to feel like they have an inadequate doctor, inadequate medical system. They aren't addressing something because they expect that if they're going to make that visit to a physician or a medical practitioner, that they're going to come out in their hand a prescription to go get a medication to fix it. So people are sort of fixated on a pill to fix them. And that's a scary thing to certainly the 12-step tradition, the recovery tradition, because the problem was you're taking medication out of context of medication to try and fix yourself or what you think is wrong, and you end up with a horrendous substance use disorder. So we have a problem with a society that definitely is out of whack. We have a developing medical science of addiction that can be extremely helpful in the treatment of chemical dependency, and actually studies are coming out right now that those programs in treating addiction that are medically oriented and now involving medication in the treatment of addiction are having much better treatment outcomes than the traditional talk therapy, counseling therapy, peer therapy that's been going on. So there's a lot of evidence-based knowledge supporting now this medical involvement of recovery treatment. There is right now about a dozen to 24 medications already approved by the FDA to treat addictions. Chantix, the most recent one, varenicline, is approved to treat nicotine addiction. Actually works in that reward reinforcement circuitry, so many addiction professionals are beginning to use it off-label. They don't use it just for nicotine. They're treating methamphetamine addiction with it. They're treating alcoholism with it. Camprosate was approved a few years before that for alcoholism. That's being used as well to treat other addictions. We've had for years naltrexone, Revia, and Vivitrol that's on the market that's been used to treat a number of addictions, not just alcoholism. We have the Wellbutrin approved for nicotine and also being used in stimulant addiction. We have Antabuse, which used in alcohol, now being used to treat stimulant addiction as well, as it's an interesting thing. It just seems to produce the same negative effects. If you're on Antabuse and you use cocaine or methamphetamine, you feel very bad, and so it's a deterrent to use in that way. We have Suboxone, which is probably one of the more controversial things that brings up this old challenge between the traditional recovery 12-step orientation and the new age medical treatment, because Suboxone is a mu antagonist. Heroin's a mu antagonist. It's being used to treat opiate addictions, and predominantly now we're seeing a lot of the Vicodin, Norco, Lortabs, Oxycontin, and we have a huge load of that. And we're having, much to the chagrin and scare of the traditional recovery field, we have young people especially coming in with Oxycontin or Vicodin abuse saying, I'm not going to come here unless you have Suboxone, and you can treat me with Suboxone. Well, Suboxone is abusable, but it has some unique characteristics, a lot better characteristics than the old methadone, which was one of the original medications used to approved to treat heroin addiction. That makes it useful and is helping a number of opiate addicts recover. So we're coming sort of loggerheads with two very huge public health issues and two medical issues. The drive for human beings to want to find a pill to cure everything, and the drive to find effective medical treatments of addiction. But I think where we're going to end up, and where I see a lot of promise happening, is right in the middle. We're going to get lots of good effects from these medications, but they're going to be worthless unless they're used within the traditional practice of recovery treatment. The counseling, the peer, the spiritual, all of that is vital for maintaining continuous sobriety, and that's going to be the thing that makes these medications effective. But the medications are going to make those efforts and those activities more effective. So I think the marriage of the two is going to lead to a good thing, but we're going to be in this rough era where they're sort of competing against each other in terms of traditional values and traditional use situations.
That wraps our pod for today. Thanks for visiting the CNS Podcast. Please check back soon for the next in the series and visit our website, www.cnsproductions.com.